Hey, what's up YouTube? So I'm gonna do this little discussion on hemophilias, and I'm gonna try and make it at least really easy for you to remember all these hemophilias just after watching this video. I'm hoping you can sit down, write down all the hemophilias, what the molecular biology is on those hemophilias, and have no problem recalling basically what these terms and names mean. So yeah, we're going to talk about hemophilia A through C, and then we're going to mention von Willebrand's disease, and we're going to also talk about the PT test and the PTT tests with respect to those diseases, and try and see if we can get a grip on what we'd expect from those tests, and maybe do a little review with respect to that. We're not going to talk about the whole coagulation cascade here. We're just going to talk about the relevant molecular biology to understand these hemophilias. So hemophilia A and B, starting out, are both X-linked, and a little mnemonic I have for that is A and B are all boys. Obviously that's not strictly true, but that'll remind you that basically you're going to see this very much more often in the boys. I'm not sure totally what the incidence would be in females, but obviously it wouldn't be too high because of that. So specifically talking about hemophilia A now, hemophilia A is a deficiency of factor 8, which is in fact a cofactor for 9. And that's just an aside. But basically you can remember this as hemophilia A as in 8 spelled with an A, maybe more phonetic way to spell A anyways. And a little aside that you may care to remember is 80% of hemophiliacs are deficient in factor 8, that is, they are hemophilia A. So if you're a betting person and someone tells you that they're a hemophiliac, you might say, I bet you I could guess which hemophilia you have, and you would of course say they have hemophilia A as a guess, and you would have an 80% chance, especially maybe higher if they're a male, that they are in fact a hemophilia A. So hemophilia A is the most common hemophilia. And so looking down here where that's going to affect it, we have hemophilia A, that is a deficiency in factor 8, which is, as I mentioned, a cofactor for 9. So here in this diagram you can see it sitting next to 9 as they convert this 10 into the active form. So hemophilia A, factor 8, cofactor for 9, 8 spelled incorrectly with an A, and 80% of hemophiliacs with an A. The hemophilia B, also called Christmas disease, is a deficiency in 9. So basically I got two little mnemonics to remind you of this. So the hemophilia B, you say hemophilia bottle of wine instead of B, and let the bottle of wine remind you both of first, Christmas disease. So people might drink a lot of red wine, so the red wine can remind you of blood, and the bottle can remind you, the bottle of wine that is, can remind you of the number 9. So bottle of wine, number 9. And so maybe you could look up wine and Christmas and maybe print that and look and put that in your notes in order to remember this in the long term. And then also, yeah, I guess that's all I had to say about hemophilia B. We can look at this also, however, and see again that factor 9, of course, was a part of this intrinsic pathway, and taking 8 as a cofactor. So the X-linked are basically this is the extent of the X-linked problems is right here in the coagulation cascade. All right, on to hemophilia C. Hemophilia C is not sex-linked because it's not one of the all boys, AB, right, in that mnemonic. However, it is common in a given population, and it's the Ashkenazi Jews. And so we're going to think Red Sea. So Red Sea as in the biblical story of Exodus with Moses and so on. So Red Sea. So hemophilia C, someone says I have hemophilia C. Right away you know, okay, Red Sea, Red reminds the hemophilia reminds you of red, and then C reminds you of a red C. Oh, maybe they're Ashkenazi Jew. And secondly, I have this pictorial mnemonic. I would suggest you also print something like this out and put it in your notes with this red sea water basically, and then 2 lighthouses, each one of them representing number 1 and number 1. Together they give you an 11. And so hemophilia C is a deficiency in factor 11, and factor 11, just like 9, is in this intrinsic pathway, and so you'll have a slowing of that intrinsic pathway clotting cascade. And remember, this cascade is the fibrinogen portion of cascade. There's also sort of the platelet aspect that has to also come into play, because remember, the fibrin mesh holds the platelet plug basically, and that's what creates a competent and is the full expression of a clot, right? So some people will talk about PTT tests, or maybe it's relevant for you in your studies or in your clinical life, whatever. Some people will talk about PTT times and or PTT tests and PT tests. And man, I know I've studied this so many times, and I had just so much problem trying to get this to stick in my head. So finally I decided to make some mnemonics about it. So PTT basically stands for partial thromboplastin time, and PT stands for prothrombin time. So basically, I have this mnemonic right here. So thromboplastin is tissue factor and phospholipids, right? So let the T in thromboplastin remind you of tissue factor, and P remind you of phospholipids. And I admit this is confusing. Why are they just saying what this thromboplastin? Why is it tissue factor and phospholipids? I'm not totally sure why it's named like this. It definitely is creates some confusion, because when someone says, okay, here's a bottle of thromboplastin, what are they really saying to you? They're saying, here's a bottle of tissue factor and phospholipids, right? And so in order to understand this, you have to know this and understand this fact. Thromboplastin is tissue factor and phospholipids, right? And so when someone says a partial thromboplastin time, what they're saying is we're basing this test on a partial thromboplastin. And so what does that mean? We have to also interpret this confusing terminology. So partial thromboplastin it's basically part of this thromboplastin, and so it's just plastin. It's not plastin. It's the P in this mnemonic. So it's just phospholipids. So partial thromboplastin is based solely on a phospholipid molecular biology test, and the thromboplastin test, or the prothrombin test, is based on thromboplastin, right? So basically, this will now come together as so basically a hemophiliac is a true hemophiliac has a prolonged partial thromboplastin time and a normal PT time. So why is the PT time not affected, whereas the partial thromboplastin time is affected? So remember, partial thromboplastin time was based on addition of phospholipids to initiate the coagulation mechanism, whereas PT was based on the addition of thromboplastin. And so basically what these two tests can do is they can isolate each aspect of this coagulation cascade, with the PTT test being a test of the intrinsic pathway and the PT test being a test of the extrinsic pathway. So if you remember before, hemophilia A was a deficiency of 8, and hemophilia B was a deficiency of 9, and hemophilia C was a deficiency of 11. And you notice that all these are grouping within the intrinsic pathway, and therefore they are going to affect the PTT, or the intrinsic test, the test for intrinsic clotting, and they are not going to affect the PT test, which is, as you recall, is a tissue factor test and a phospholipid. So tissue factor and phospholipid are added, and that initiates this aspect of the cascade, right? Whereas over here you add phospholipids and you initiate this intrinsic pathway. All right. So lastly, we have the von Willebrand's disease. It is also not X-linked, just like hemophilia C. It is autosomal dominant. But von Willebrand's factor is especially important because it's converts factor. It's important as a cofactor for factor 8, and it is also important for platelet aggregation. So it is both important to this cascade and also important to basically the activation of platelets, so where they become labile and want to participate in this fibrin platelet clotting mechanism, right? And so von Willebrand's disease is going to be a defect in these von Willebrand factors. And basically what von Willebrand factor is really is a glycoprotein, and like I said, that it's important for both factor 8. And so again, notice that is, as we remember, factor 8 is a cofactor for factor 9, so that's going to affect, again, the intrinsic pathway. So all these hemophilias are affecting the intrinsic pathway, and therefore a true hemophiliac, as we mentioned, is going to have a prolonged partial thromboplastin time and normal PT time. So say you say someone is suspected to be a hemophiliac, and you mistakenly say, I want to do a PT test on this individual and test their clotting time. Of course, hopefully someone's going to call you out and say, that's not the right test you're going to want to do to test for hemophilia. You're going to need to do the PTT test. And so hopefully that gets done and the person gets properly diagnosed. All right, to recap real quick, let's just go through what our mnemonics were. So hemophilia A was factor 8. Hemophilia B, so we remember A for 8 as in AIGHT, misspelling the number 8. And factor B, bottle of wine. Wine rhymes with 9. Red wine is red, reminds us of hemophilia. We're also drinking wine during Christmas, so it's also called Christmas disease. Hemophilia C now. Hemophilia C is a deficiency of factor 11. We remember hemophilia C as the red C, that reminds us of blood. And also we have this picture mnemonic, reminds us of 2 lighthouses on the Red Sea, and that's factor 11. So hopefully those mnemonics are working for you. Actually, one more mnemonic I actually forgot to put in this is how to remember von Willebrand's disease. It's associated with, associated with 8, and you can remember this because the V in von Willebrand, or von, the V in von, don't confuse this and say, oh, it reminds me of 5. You have to remember that it's going to look like an upside down A, and therefore be important for factor 8, AIGHT, and then also you might remember that is important for sort of getting the platelets ready to go and having them stick to the exposed collagen portion within this intrinsic pathway. Alright, I think that's all I have for this little discussion. Thanks for watching. Maybe now you could pull out a piece of paper and see if you can remember not the whole coagulation cascade, but basically what each hemophilia affects on the molecular biology level, and then maybe remember some bits about this tissue factor or the thromboplastin and PTT test and PT test. That can be a little confusing, so it's important to get that straightened out, maybe on a piece of paper. But yeah, thanks for watching. Cheers. Good luck studying.